Have you ever had feelings of panic, fear, or uneasiness? Have you ever had feelings of terror that strikes suddenly and repeatedly with no warning? Or do you have an intense fear of a specific object or situation? If so, you may suffer from an anxiety disorder. Hello, my name is Jilly Lewis, and today I'm going to be informing you on the different types of anxiety disorders. There are several types of anxiety disorders, including panic disorder, social anxiety disorder, specific phobias, and generalized anxiety disorders. Anxiety is a normal human emotion that everyone experiences at times. Many people feel anxious or nervous when faced with a problem at work, before a test, or making an important decision. Anxiety disorders, however, are different. They can cause such distress that it interferes with a person's ability to lead a normal life. Anxiety disorder is a serious mental illness. For people with anxiety disorders, worry and fear are constant and overwhelming and can be crippling. The first type of anxiety disorder is the panic disorder. People with this condition have feelings of terror that strike repeatedly and suddenly with no warning. Other symptoms of a panic attack include sweating, chest pain, palpitations, and feeling of choking, which may make the person feel like he or she is having a heart attack or going crazy. Social anxiety disorders, also called social phobia, involves overwhelming worry or self-consciousness about everyday social situations. The worry often centers on a fear of being judged by others or behaving in a way that might cause embarrassment or lead to ridicule. Specific phobias are intense fears of specific objects or situations, such as snake, heights, and flying. The level of fear is usually inappropriate to the situation and may cause the person to avoid common everyday situations. Generalized anxiety disorders involve excessive, unrealistic worry and tension, even if there is little or nothing to provoke that anxiety. The symptoms of anxiety disorders may include feelings of panic, fear, and uneasiness, problems sleeping, cold and sweaty palms of your hands or feet, shortness of breath, heart palpitations, an inability to be calm or still, dry mouth, numbness or tingling of the hands or feet, nausea, muscle tension, and dizziness. The causes for these anxiety disorders are problems in the functioning of the brain structures that control memories linked with strong emotions. Anxiety disorders also run in families and are inherited, and environmental factors are a cause as well. Treatments for anxiety disorders include medications. Drugs to reduce symptoms of anxiety disorders include antidepressants and anxiety-reducing drugs. Psychotherapy and cognitive behavioral therapy are also treatments. Lifestyle change and diet and relaxation therapy may help as well. You may wonder how common anxiety disorders are, and anxiety disorders affect millions of adult Americans. Most anxiety disorders begin in childhood, adolescence, and early adulthood. They occur slightly more often in women than in men and occur with equal frequency in whites, African Americans, and Hispanics. Can anxiety disorders be prevented? And they cannot. However, there are some things you can do to control or lessen symptoms. If you think you suffer from an anxiety disorder, you may want to try these out. Stop or reduce consumption of products that contain caffeine, such as coffee, tea, cola, energy drinks, and chocolate. Or ask your doctor or pharmacist before taking any over-the-counter medications or herbal remedies. Many contain chemicals that can increase anxiety symptoms. And seek counseling and support if you start to regularly feel anxious with no apparent cause. Thank you.